Welcome to Cups and Courage, the podcast. Today's guest is Tamsin, and Tamsin was diagnosed in 2020 with breast cancer. She had a double mastectomy and chose to remain flat. Cups and Courage, the podcast. Hello, Tamsin.
Hello, Samantha.
Lovely to have you.
It's lovely to meet you,
Thank
having seen your chest for a long time.
Right, seen each other on little grids.
Yeah, on little grids, yeah.
Online.
Yeah.
What did we do before that?
Probably got reconstructions when we were told to. Possibly got things we didn't want to do.
Yeah, maybe. But it's great to meet you in person.
Yeah, it's lovely to meet you.
I'm also really intrigued and excited about what you've brought, because the feedback is that I'm not expecting this and I'm not quite sure.
I'm allowed to
what
drink
this
tea
is.
while we talk.
Absolutely.
Yeah.
Drink your tea, and you're going to have
They're
one
my
of these.
second favourite biscuits. I couldn't get my first favourite biscuit.
Can I ask you what your first one was, or is it worth me having a look at these first?
Yeah, you can ask me what my first
What
one.
would be your first choice?
Ice gems.
Oh,
But they're surprisingly hard to find.
Yeah.
You have to go to Iceland and get like a party pack.
Yeah.
And there was no Iceland open, so I couldn't get
So you
some
couldn't
ice
get
gems.
your ice gems.
I couldn't get
Okay,
my
here we
ice
go.
gems. Not like ice gems at all.
So there is confusion here, because that is not a traditional biscuit.
It's actually called a toast, I believe,
Is
on
it?
the packet.
Well, and I don't think I can dunk it. Although there's part of the rebellious side of me that wants to give it a go.
You could try.
Yep, we
You
will.
could also have it with cheese, but I actually have it as a... Am I supposed to show this to the camera? An afternoon biscuit. It is a very posh plum and date toast, which I think you're supposed to have with cheese, but I just really like them because they're quite hard, and I like having like a crispy snack when I'm working in the afternoon.
Yeah.
That I can also have multiple biscuits or toast.
Okay, I'm gonna give it a go.
Am I allowed to eat before you do? No, I'll wait for you. Actually,
Are you sure?
Yeah.
Okay.
It's crispy.
It's very crispy. No, it's pleasant. It is pleasant.
Not the biscuit you were expecting.
No.
Also, not at all like an ice gem. I'd say it's the opposite side of the spectrum, biscuit spectrum.
I'm not even going to try and dunk it, but I would only be doing that because...
Look, I have dunked it before, but you have to hold it in the tea for quite a long time.
Great. Thank you for bringing... I like these.
Now we can't talk, though, because they're quite also crispy and chewy. The date part.
Tamsin, what's your definition of courage?
I thought about this a lot because, as I told you, I haven't listened to any of the podcasts. So I might be repeating what other people said. I didn't want to listen because I didn't want it to influence what I was going to say. But I think there's lots of different variants of courage. I think the one that always inspires me the most are people that put themselves out in going for what they believe in, trying to make things right. I think also courage can be believing something, getting more information, and then realizing that what you believed wasn't right anymore. I think courage is used a lot in cancer talk, and I think sometimes it's a bit controversial, but I think sometimes it's a bit misplaced. So I've had two cancers. So breast cancer was my second cancer. My first cancer was Hodgkin's lymphoma, and that was in my 20s. And I had a lot of friends at the time say, "Oh, you're so courageous." But I think what that meant was, you're doing something that I'm scared. And it's really scared me that this has happened to you because you're only in your 20s.
Yeah.
And you look fine. So that's making me feel a bit better. But you have to go through this thing that I'm scared of. So that means that you're courageous. But I think I'm not saying that people going through treatment aren't courageous, but it's not a choice. And I think a lot of courage involves choice. So it might be a choice in how you react to your treatment, but you go through it. And I also think courage can be quite... The way it's posited in the media can be quite individualistic. So I'm terrible with names, but I love Black Panther, the Marvel film, and the man whose name I should remember, I don't know if anybody remembers his name, who played Black Panther, died young from cancer.
Yes.
And I don't know if you remember, the media made a big deal if he didn't tell anyone because, he wanted to be a superhero for the kids. And I think that's great. That is the reason that he gave. He didn't want people. But we don't know he didn't tell anyone. He might, he had a tight-knit family.
Mm-hmm.
I'm sure he had lots of support from his family. But it could be equally courageous to break down and say that you're really scared. That could also really help people. Not from him. I'm saying in a different situation. His reaction was right in his situation. And I think what I mean by individualistic is that cancer happened to me, and a lot of people helped me to get better from all the research that's ever gone into cancer treatments, to the surgeons, the oncologists, the nurses, and then family and friends. So I don't feel great, especially when I was in my 20s. I felt that was very misplaced to tell me that. And it almost annoyed me when I was in my 20s when people would say, "Oh, you're so correct," because I was like, well, I didn't choose it. Anyway,
Thank you.
I don't know if you have any thoughts on that. Because like I said, I don't want to take away from people. I do think people can show a lot of courage going through their treatment, but I think it's more complex than
I totally agree. And I think it's so layered, isn't it? And what what one person's act of courage is somebody else's, it's just me putting one foot in front of the other. It's just because our experiences right now look different and you can't possibly understand or compute what this is. So,
or I feel like, I mean, you are, I think you're very, I don't know if I'd say courageous, but I really admire you because you're a real activist. You do something and you're trying to make things better for other people, and I feel quite lazy in comparison. But I feel like we're quite similar in that I don't mind talking about it at all.
Yeah.
And I don't think you mind talking about it at all, but that's not me being courageous. I just literally don't mind talking about it at all.
Yeah.
But for somebody else, it might be really hard.
Yep.
Like, I've spoken to quite a lot of, in my various hospital appointments, African origin women, younger women who are working in the hospital in lots of different positions, who say like, "Oh, my mum or my auntie had it, but she never talked about it.
Yeah.
She could never talk about it because it was so difficult in her cultural environment."
Yeah.
So for those women, it would be very courageous to talk about it. But for me, it's I don't have that hurdle to overcome, so it's not me being courageous anyway.
I get it. And I think the lens of when you put cancer with courage, a lot of, that looks different. I totally agree, because courage is throughout the whole of our life, right? The things that you do when actually it could be easier to not do them, but actually going through treatment and everything, you got to do it, because, you don't have to, you can make those choices.
Yeah, you don't have to.
But, so you've inferred a little bit about your own experiences in your 20s, and actually that was the first time, but you've had it twice. Can you give us a little bit of an overview about who Tamsin is and quote unquote your journey? Plural.
I mean, who I am with too long.
Little overview.
I guess I was in my 20s. I was working in snowboarding, so I was a lot of that came afterwards, but I was already snowboarding. I was starting to write about snowboarding. I was very healthy, and I had a cough that had gone on for a long time. I was living in the States at the time, so I'd done a year abroad for college. I did an undergraduate degree and I did a year abroad. And so I was traveling a lot, but I had a cough, my legs were itchy, all these various little symptoms that you just don't put together. My brother had asthma, so maybe it was a family thing. I'd seen doctors, but they were always different doctors. I'd come back and got checkups. And in fact, my dad even at one point was like, "I've got a Nuffield voucher from the Daily Mail. Why don't you go and have a proper checkup, because you've been coughing for a long time?" And because I was young and I was really healthy and I was in the mountains all the time, I guess I had great lung capacity. They said, "No, you're fine." It turned out later that one of the markers in that private health check was way off the charts and should have been investigated, but they just put it down to me having had a cold recently. And then I got off a plane and was in California and was coughing up blood. And my friend said, "You're going to the doctor with me tomorrow." "I'm going to work, you're going to the doctor." And I went with her to her GP in Santa Cruz, of all places. Fortunately, I had travel insurance. And he said, right, I'm going to send you downstairs for an x-ray. And I went and I sat downstairs, and it's amazing, I think, how your brain can go into denial. Because I remember noticing that I was sitting there for ages and other people were coming and going. And I remember noticing that the radiologist was really nice to me. But I was like, oh, they're so nice in America and so thorough. And I went upstairs to see the doctor again, and he said, I was living in New York at the time, and he said, if you were my patient here, I'd bring you in for a biopsy next week. We've seen something on the x-ray that we want to investigate. But if you promise me that you make an appointment when you go back to New York, then do that. Have a nice, have your holiday here. And I spoke to him later, and he said it was because he knew that I was in for a long ride, and he wanted me to have some relaxation before it all started. So I went back again, set up a private appointment because this wasn't within the NHS because I was working in New York. And I went into the doctor's room, and the guy said, have you seen your x-ray? And I was like, no. He went, oh, well, you've almost certainly got cancer.
Wow.
So that was the first thing. And then I had a biopsy in the States, and they did it in the neck, and this was Hodgkin's lymphoma. And Hodgkin's lymphoma is quite a strange cancer. It's a white blood cell cancer, and it doesn't always show up in the biopsy. So he said, I'm not sure, actually. You might have this thing called cat scratch disease. It's like an immune reaction. But I was going back home anyway. He said, so have it followed up there because you don't have like full-time insurance here. So I went back, and again, I guess my parents had been worried, and they'd organised for a private appointment with a thoracic doctor. I didn't have private insurance, but they were just like, she's coming back. And he said, I'm going to get you in on the NHS. I'll see you next week. And I had the sort of classic, I don't know, I think quite a lot of people have had this with students, where I was in the NHS surgery, in the hospital surgery, not NHS, in the hospital surgery. And the guy said, I've got 3 students. Would you mind me bringing them in? And it was 2 men and a woman. And one of the guys felt really well, and I could tell he was feeling my glands. And the woman didn't feel very affectionately. She was sort of a bit nervous and a bit too. And then this very sort of rugby player guy went, well, stood over me as if I was a cadaver and was like, this is excellent because I've never got to feel really enlarged lymph nodes before. I was like, all right, thanks. Anyway, it turns out that I had stage 3B Hodgkin's lymphoma. So in my chest, this is why the guy was like, have you seen your x-ray? In my chest, the mass touched my ribs front and back.
Wow. Wow. That's substantial.
It's substantial. And it was in my spleen. So it was throughout my body, but it wasn't in my bone marrow. So that's 3B in lymphoma. That's what it means. Yeah. It's in all areas of your body except within your bone marrow. So I started chemotherapy straight away, and I had 6 months of chemotherapy. That was broken because I got pneumonia 2/3 of the way through because I got neutropenic. Do we have to explain what that means?
I don't think so. Well, neutropenia is a decrease in white blood cells, right? So, and it means that your body can't.
And it happens a lot when you're having chemotherapy. Yes. It knocks out your white blood cells, and it makes you very susceptible to things like pneumonia, which is what I got. And then I had 5 weeks of radiotherapy. And the thing with Hodgkin's lymphoma, because it's a white blood cell cancer, you can't have surgery for it. But the chemotherapy melts the tumor away, essentially. And the radiotherapy that they used to give was sort of for consolidation. And it worked really well. That's a great thing about Hodgkin's. It's a really harsh treatment, but it works really well. But about 3 years after I finished the treatment, I got a letter from the NHS through the post that said, we've now finished our longitudinal study of survivors of Hodgkin's lymphoma who've been treated with mantle radiotherapy, and you have, I think, a 1 in 3 risk of developing breast cancer if you've had it. And it turns out that it's the same risk as if you had BRCA1.
Okay.
Because of the radiotherapy that we were given, that's no longer given for anybody that's
Yeah.
listening that knows. So they stopped that amount of radiotherapy, I think, 10, 15 years ago.
Was that in a trial testing kind of phase then that they were
No,
doing, or did they
no.
absolutely?
And in fact, people who were older than me who started having their radiotherapy in the 60s, 70s, 80s,
Yeah.
90s, exponentially worse because the radiotherapy was harsher. So I had mine in the 2000s. So it's sort of the tail end. So they were already controlling it a bit, but it was basically far, far more, I forget the measurement, gamma rays of radiotherapy than you would have nowadays. And if I only found this out when I was diagnosed with breast cancer, but if I had been in America, I would have been offered a preventative mastectomy, but because it's treated as equal to BRCA1. But in the UK, within the NHS, and we've spoken to a representative, as in people from the Lymphoma Society, Hodgkin Society, we're too small a cohort.
Okay.
So we're not really, it's not, the cost benefit analysis for the NHS doesn't add up.
Even though it's a 1 in 3.
Even though it's a 1 in 3 chance.
Goodness.
Yeah.
Okay, so
I'm going to have a bit of a biscuit while you ask me a question.
Okay, so that was in your 20s. When was your breast cancer diagnosis?
My 40s.
In your 40s.
And that's very consistent with the pattern that for people who've had Hodgkin's.
Okay.
So it typically happens 15, 25 years after your radiotherapy.
Okay, so talk to me about that. What was that diagnosis, and what was your surgical? Because I know that you've had a double mastectomy.
Yep.
So what was the diagnosis at that point?
So because after this letter that I got 3 years after I'd finished my Hodgkin's, I was then followed up and I had a mammogram or an MRI, different protocols. Sometimes they wanted you to have a very painful mammogram every year. And then I was like, surely this is not good because of all the x-rays. And sure enough, the protocol changed. And they're like, actually, now we're going to do MRIs more than mammograms. But so I had those roughly every year. But then, and usually at the beginning of the year, 2020, lockdown happens. I ended up having my follow-up. I was very lucky because I had it in the summer gap when we were allowed to go back into the hospital again. Yeah. And you still, you had to have a COVID test and everything even before going in to be tested. And that summer I was very lucky because my mum and her husband always go on holiday to a tiny little Greek island, stay in a tiny little apartment. And they didn't want to go that year because even though things had opened up a bit, there weren't vaccines, they were quite scared. And they were like, but we don't want to not give money to the people whose apartment it is. So why don't you go instead? And I was like, oh, thank you. That's so nice. So a friend and I went out, very weird in that first lockdown summer. And I'd just been and had my test, hadn't really thought anything of it. I was standing on the pier waiting to get the boat from the tiny island back to get the EasyJet flight home, and got a phone call and I could see it was from the hospital. So I answered it. I just knew straight. And they were like, yeah, we'd like you to come in. We've seen some stuff on your test, which they'd actually said to me the time before that they'd seen something, but then they tested me again. And I was like, well, this was a Wednesday. And they're like, we'd like you to come in on Friday. I'm like, well, I'm just actually coming back from holiday. Can I come in next week? They were like, I think it's better if you come in on Friday. Oh. So I went in on Friday thinking I was going in for an ultrasound. I had, I think, 7, what's it called? It's not a biopsy. It is a biopsy, but it's where they have the little, they just stick it in.
What is it? The fine needle
aspiration. So I went on my own again because it's locked down. So you weren't allowed, and I didn't tell anyone. Yeah. But I don't want to put my, people that care about me through this again. And I'm not going to tell them anything till I know anything. And and then within a week I was called in again on my own. And they sat me down, and I'm very lucky because I live in London and I went to Barts, and Barts has excellent care, and it was an all-female team. And the woman sat me down and she's like, well, I'm afraid you do have breast cancer. It's very good because we've discovered it early, which is why I always thought they were monitoring me. It's stage 1, grade A. I forget the grading now. Grade A, stage 1, stage 4.
My grades were 1, 2, 3 as well. That's why I get
Yeah,
confused.
1A. So
Yeah.
both good things,
Fine.
basically. But there's 3 of them.
Yeah.
There's 3 tumours. It looks well. At the time, they thought there were 2, but they eventually found out there were 3, and they were all on the end of my radiotherapy field, all on the edge.
Okay.
So all close to my chest wall, which meant they couldn't get clear margins. But that's another. She's like, and I was like, oh, okay, well that's good. She's like, yeah, you're going to have a double mastectomy.
Okay.
I was like, what? I thought you were testing me so that I could get it treated early. She's like, yep, but you can't have any more radiotherapy because you've already had too much radiotherapy. So you can't have a lumpectomy. And they're all on your chest wall anyway. But that's sort of by the by. If you've had the amount of radiotherapy that I have, you can't have any more radiotherapy.
Yeah.
And I think at the time, I'm probably exaggerating because in that first appointment before they'd actually done the mastectomy, they don't really stage you until right after, but they knew it was early stage, and that was a massive shock. And it was funny because I never got angry during my first diagnosis, and I was never like, why me? But I felt really angry when she told me, and I think it was because I thought they were monitoring me, and I didn't. I had probably been told but it just hadn't been made clear to me because there wasn't this consistent follow through that a mastectomy was the only thing that I could have, even if they found it really early.
Yeah. Okay.
So I actually had to be like, can I go outside for a minute and come back in and have a conversation? And then she just immediately, she was very nice, but she was quite surgeon like, this first surgeon, very business like. And she immediately started going through the different reconstruction options. I'm skinny, so I probably wouldn't be able to have it off my stomach. But
did you have big boobs? What were boobs?
Yeah, so I did actually have big
Yeah.
boobs for my size. So I was I'm trying to remember my bra size now. That's really weird. I can't remember. I thought it was a 30E.
Wow. Okay, so you did big boobs.
Yeah, so I had big boobs. Not big, for my size.
Yes.
I had big boobs.
Yes. Yeah.
For my size, I had big
Yeah.
boobs. Because obviously back size and cup size
Yeah.
relate.
Yeah.
But
Yeah.
so yeah, I had boobs. Like
Yes. Yes.
They were boob.
Yeah.
They
Get
were,
it.
I liked my boobs a lot.
Yes.
They were out there.
Yeah.
And yeah, so she immediately started going through all these options. But she didn't really talk about the fact that I'd had radiotherapy before. But I was thinking about that in the back of my mind, like, does that mean my skin? Because anyway, I can't remember what she said. She said something in passing about people not getting it done. And
not getting
reconstruction. Right. And it seemed like a really large percentage. And I said, what percentage did you say don't get reconstruction? And she said, 60, but those are older people. I don't want to.
No, I know.
She might not. I'm sure she said it.
I know.
In a much better way than that. And I just thought, oh, okay. She said, you probably. Anyway, go ahead, take all these leaflets. You know what it's like. She talked to me for a long time. She was really lovely.
That's good. Yeah.
She was really considerate. She was very professional. But take away all these leaflets, and go ahead and think about it.
So you've gone away. You've got all these leaflets, and she's gone. Go and think about which reconstruction options you would like.
Yeah, and it's lockdown, so everything's closed.
Yeah.
There's none of the cancer centres that are. There's no groups.
Yeah.
There's no one, but they did offer me online counselling because, you probably know, if you choose to have a mastectomy, you have to have counselling before they'll give you the go ahead.
I think so my experience is slightly different, and I don't want to jump into yours.
No,
so
please.
But my understanding is that if it's around the symmetry, so if you're asking to remove healthy breast tissue, I think that there is potentially a different pathway to make sure, because I didn't have a clinical assessment of my, my mental health and my understanding of the situation, but that might actually not be true. You might just be triggering a memory that I think I may have had an informal discussion around. Do I understand the severity of what it is?
Yeah,
I did, but it wasn't counselling. It was almost like an assessment to make sure that I knew exactly what that decision meant, and.
Yeah, I think they
Yes.
said to me, they wanted to make sure that I knew. And I
Yeah.
think within BART, the system is that they have clinical psychologists.
I mean,
So that
great.
was somebody, I think it's probably not as stringent, like you said, as around symmetry.
Yeah.
But they were really pushing me towards reconstruction. And
Mm.
then I went home and I started doing research. And we don't need to go into all of it, I don't think, unless you want to talk about it.
No.
But very specifically, if you've had the amount of radiotherapy that I've had before, there are women who've had Hodgkin's that get successful reconstructions. But again, your risk of capsular contraction is way higher. Your risk of other types of rejection, of things not working.
Yeah.
And then also, because of all the radiotherapy I've had, I've already had arms and shoulder problems, because the way it was explained to me, and again, I didn't really know this about my first treatment until the breast cancer diagnosis. But if you've had that much radiotherapy, it's almost like your tendons and your muscle fibers are like an uncooked steak. And once you've had radiotherapy, they're slightly cooked.
Yeah. Okay.
And I had always had knots and problems with my neck getting
Okay.
tight, and that's very common apparently in people that have
Okay.
a lot of radiotherapy. So that worried me, but I still was really like, I'm single, I like my boobs, and I just went back and forth and back and forth. And the first non-reconstruction flat that I saw with these pictures I think we talked about before, of women who had posed, I think it was the cover of the New York Times, or it was one of the American newspaper magazines. And obviously these women had a lot of courage, talking about courage, to post that.
Yeah.
But at the time, the surgery really wasn't very good. Like it really wasn't done very well. And it scared me. I was already thinking along, well, maybe I'm not going to get reconstruction. And I play drums, so as well, I was really worried about
Range of
messing up.
movement.
Yeah, range of movement, messing up my. And because my options were quite limited, because I'm skinny, so my option was really, they went away and talked about it. Because I'm skinny, because of the radiotherapy beforehand, it would have been either microsurgery, taking something from my thighs, not from my stomach, and my thighs are really skinny anyway, and then scars at the top of my thighs, or silicone underneath the muscle. So they lifted my muscle and put it under the muscle. And you have to fill the space that was there, because I was like, well, maybe I can just go smaller. But no, they need to. So I was probably been even bigger. And silicone means that I already feel the cold a lot. Silicone, people talk about how cold it makes them. They can't feel touch through it. Some people can. I think surgery is getting better and better. But yeah, I was still really back and forth. And the first picture that I saw that really encouraged me was actually a picture of you, because you posted that, and I was like, oh, she looks good. Maybe I could do that. And then I think I found Less Than Two Breasts, that American site.
Yeah.
And they also had some really inspiring pictures. And then also, I've got quite a few trans friends, and I had a friend that was in the lead up to their gender affirming surgery and having their breasts removed at the time. And they shared their material with me, and I was thinking like, wow, if they can get such amazing finishes. And it's different because you don't have to remove the fat, right? So for breast cancer, you have to remove the fat, but still, if their chest can be tight, and so that gave me more encouragement. But still, I was crying all the time and sort of flipping back and forth and thinking, do I want to do this to a future man I might be with because I'm straight? People often think I'm gay anyway, because I'm not, classically, I'm quite a tomboy. I've always been quite, whatever people want to call it. They were really good at the hospital. They actually extended my surgery date because they could see that I was struggling with it. And they came in and they showed me some surgical finish pictures that they had. And then it ended up that because they extended it, I got a different surgeon. And she was great. Her mum had breast cancer. She came in her little leopard skin heels, short heels. At the time, it's her surgical mask that she'd made herself that was floral. And I was like, I think I'm leaning towards flat, but I want a U shape, because I don't want it to look masculine. I don't want it to look like my friends that have had top surgery.
Yeah.
And I don't want nipples, because again, I don't want it to look like I've had top surgery. That was why I didn't want it to happen. And I also my final decision was that I loved my boobs, And I felt like whatever reconstruction option I went for, I would always slightly resent them because they
Okay.
weren't my original boobs.
Yeah.
And so I just came to the understanding that I thought I would feel hotter as myself
Oh, I like that.
rather than like
Yeah.
apologizing for my breasts. Sort of, I feel like I would have ended up apologizing for them a bit,
Yeah.
but it was really hard. It was really, really hard up until I had the surgery. But yeah, so I said to the surgeon, can you make them use, and I just want to look as hot and tight. And I just sounds so vain, but we're allowed to be vain.
Yeah.
I just want to look as hot as possible with no breasts. And she was like, yep, she
I
totally
got you.
got the assignment.
Yes.
And I came out as the last person to go in that day. Again, lockdown went in. I felt so bad because there were women in there that didn't speak English as their first language, and their kind of adult daughters had dropped them off but weren't allowed to come in with them. We were all more spaced out in the hospital, and I was in my ward. It was all older women that were trying to manage their tablets that their adult children had given them, and the Wi-Fi wasn't working and all this. So I felt very lucky. I was the last one in the day, and I came out, and the surgeon was like, yep, gave you an extra hour to tighten you up. She was really pleased with herself.
Great.
And I had a little cry when I came around from the surgery because it was sort of the waiting was over, and then I've never regretted it.
Okay, that was going to be my question. To come from a space of being quite turbulent about which way forward and to really assess both of them. Have you ever looked back and gone, what if?
No, no, never.
How
There are a few things, like there are some dresses that don't fit me.
Yeah.
Like I'm like, oh, my strappy tops don't look as good anymore. And when I wear swimming costume, bikinis, swimming costume, it's like we're a child. When I wear a bikini, I double pad just so it looks
Okay.
like, and the same if I'm in a sports bra, just so it looks like I'm an A. But if I, like today, I'm absolutely fine looking
I've
flat.
never thought about that. I've never thought about that because I have a bit of a thing when I sometimes go bikini shopping or swimsuit, shopping or top shopping. Some pads are sewn in, and I get really pissed off.
Yeah,
honestly, you're taking that choice away from someone. Because so I get quite, and I'm a massive advocate for removable pads or put them in. I don't care what you do, but give the woman the choice. Don't assume that everybody wants that. But I often go for, obviously, for me, removable, because I haven't actually thought about the shape, because it is even that little pad is a different shape, isn't it? And so, but I haven't thought about doing that.
And weirdly, I mean, it is a reflection of how the strange beauty ideals that are behind the design of women's clothes.
Yeah.
Because I'm skinny, clothes fit me better now. For the most part, clothes fit me better. And now I can wear like little H&M bikinis, and then I just double pad, and they suit my body.
Yeah.
Whereas before they weren't supportive enough because my boobs were. So, but yeah, I think it's odd. It's just in bikinis and sports bras. I don't mind being naked. I'll go to a spa, but I feel like I look like a prepubescent child, and that's something I don't like.
I'm nodding because I empathise, not because I agree.
Yeah.
Right. So I'm not going.
Yeah.
Yes,
but I don't. It's weird because I don't feel like that when I'm wearing a tight top. I don't feel like that naked. It's just in a bikini and a sports bra. And I think it's just maybe something to do with the way that they're designed, so the way they sit on your chest. I think
it's also about the curvature of a body as well, isn't it? And actually, if you had like the curve from your chest anyway, and that curve because of the your ribs are still there, but because the shape has changed.
Yeah, although like I said, I feel very lucky. I don't have indentations.
Yeah,
it was done really well. I've got quite big ribs, so I kind of already have a slight. I really have. There's been a couple of times I've caught people looking at me, but I think for the most part people just don't notice at all, because I do have. I understand it's very different. I have skinny privilege. I think that is a real thing when it comes to mastectomies. I know that women who are larger can feel more out of proportion, or women who have more hourglass shapes. But because I've always been very straight up and down, I pass. Yeah, so it's easy for me to say, oh yeah, it's fine. But also I'm
I
aware
get
that I'm
this.
not under
Yeah.
people's scrutiny in the way that other people might be.
Yeah. I hear that. I really do, because I think there are some things genetically that you can't change anyway, you
Yeah.
know. So actually, some of us, and I'm not normalizing it or reducing anybody's experience, or, you know, but it's not the same for everybody.
It's not, yeah, it's definitely not. So that's why I don't want to be like, oh yeah, it's you know,
I
it's a
get
walk
it.
in the park. But it is for me, but it's not necessarily for other people.
Yeah. Yeah. Similar to you, I'm not often really consciously aware of it. Um, but I remember I was delivering. So I was doing some training for a corporate organization, and it was hot. I was overseas, and I
Yeah.
was wearing, like, I had a blazer, and I had just like a camisole top, but it's quite slim fitting, and it was hot. And I took off my blazer, and and obviously I don't lead. You know, if I'm talking about communication skills, I'm not going to lead with, by the way, I don't have breast. It tends not to be that relevant, but I've spent the day with these people, you know, and I'm standing up, and everyone is watching me for you know, large proportion of it. And anyway, the day went. Obviously, no one's going to say anything because that would be weird. But of the evening, we all went out, and someone, I think it'd come up, you know, around, not me being flat necessarily, but around cancer or something, and a couple of the women then said, "Oh yes, no, we noticed. We thought, you know, we thought that," and they were talking amongst themselves, and it's really interesting. If I suppose I wasn't aware that they noticed. I wasn't necessarily feeling insecure about it.
Yeah.
But actually, in the evening, the fact that they had validated that they noticed, I suddenly went, "Oh, I didn't," you know,
Yeah, you'd
because
forgotten that
I'd
some people
forgotten that
do.
you just,
Yeah, that
you
some
know,
people do.
that. So I think it is. I think it's about being able to shape it. Everyone's got busy lives. They're all dealing with all different stuff. No, people aren't as focused on us as we think
Yeah.
they are, just as we aren't focused on anybody else. But some moments, yeah, I think it, you know, it's a difference, right? It's a body difference,
Yeah, it
as
is
we're
a
all.
difference.
I notice it in changing rooms,
Yeah.
swimming.
I
That's
know,
when I
yeah,
notice
that's
it.
when I notice from other women
Yeah,
that they'll catch a glance.
that's
But
it.
again, in fact, I had one experience where it's making me sound like I travel around the world all the time, and I don't. When I was in the mountains, but I was in Paris,
Yeah.
and we went. There's a large mosque there, and there's a hammam, a women's hammam, and a group of us went in, and I noticed, and then talking to my friends later, they noticed that the women working there were being a little bit off with us. But we thought maybe that's just because we're like white English girls that are coming into the house. I mean, a lot of tourists go,
Yeah.
tourists go
Yeah.
there. And then you have the treatment where they brush you down. And I said to them, oh, I've had a mastectomy. I speak French. So I said, oh, I've had a mastectomy. So it's a little bit tender on the chest. And immediately they started being nicer to all of us.
Really?
So I think maybe they thought, they weren't sure if I was trans.
Ah.
And I think this is an experience that obviously highlights prejudice in society, and that I notice on some of the cancer groups I follow on Facebook seems to be happening to quite a few women in the States, where because there's a sort of anti-trans fervour, they're also getting that in bathrooms and in
Wow.
changing rooms.
So
So I thought that was an interesting experience. That was from other women, and in a particular cultural context as well, because it was within a hammam. But yeah, once they knew it was cancer,
just on
I'm just drawing, but my friends noticed it as well, and we weren't talking to
yes.
each other about it. So
Yeah.
that's why.
So I'm going to frame it. So what you're saying is, actually, some people are, well, we're aware that people might make assumptions that it's because we are trans, rather than actually it's a medical reason as to
Yeah.
why, and that changes how potentially people behave with us.
Yeah.
You
And
know?
I think especially, maybe not especially, but perhaps because I look younger and I've got skinny privilege, there's not an assumption that I've had. And because my scars are really
You don't
nicely
look
done,
sick. You
I
don't
don't
look
look
poorly.
sick.
Yeah.
I don't look like the cancer patient,
Yeah.
although I have looked like that in the past.
Yeah. Yeah, I get that. I felt that more when I lost my hair as well.
Yeah.
there was a period of time where, I felt socially, visually more masculine than I had ever, or more not masculine, androgynous.
Androgynous, yeah.
So I was, hyper aware of it, and because I'd had long hair,
Yeah, I had a girl come on to me when I had no hair. This was because I had no hair during the lymphoma.
Yes.
And it was one of the first times that I went out. I think I'd finished, because I didn't go out at all during the chemotherapy, but I had gone out in the period between when you have your chemotherapy and your radiotherapy to a friend's event. And a woman started chatting me up. And you could see my friends all getting really, she was like, I really like your hair. That's great.
Courtesy of the NHS, thank you so much.
Yeah, exactly. And it was like, I'm really flattered, but
yeah. It is interesting. I have friends who have had experiences where, and I haven't had the same experiences, but I think that's why my hair loss really hit me hard, because it was the thing that, I could, the femininity,
Yeah.
whatever that social, whatever it is for you,
Yeah.
right? But a friend of mine, has the experience, that she's had it before. If she's going into bathrooms, whatever, there is an assumption she's got super short hair and is flat, and I don't have that experience, but I hear it and I can see how that would be, the case for some people.
Yeah, I can't lie. I definitely wouldn't have short hair. No, I don't think, even though I had short hair when I was younger and had that experience as a non-cancer person with short hair and who wore quite boyish clothes going into toilets and had big boobs, and then I would turn around and immediately people would be like, oh, you're a woman.
It's so hard though, isn't it? Because it's actually nobody's business.
No, it's nobody's business. And I really was, I see a lot of people worried, and I was very worried that, what was I worried? I didn't think I would feel less womanly when I made the decision to stay flat. But I see that a lot of people are worried that. I was worried about sexuality and the way I presented to other people. But I don't at all. It doesn't make me feel any. I woke up and was like, oh, I feel exactly the same.
Yeah.
Exactly.
Yeah.
Why did I think it would make me feel? I still feel like exactly the same person. And then weirdly, it was interesting you were talking about the androgyny, because like I said, I really like my boobs. I've always dressed in a sort of tomboyish way, but in terms of wearing bikinis or going naked, if there's a occasion to go naked in a spa or whatever, or sexually, absolutely no problem with my like my body, didn't have problems with my body. But once I didn't have boobs, I realized, or I had this, there was a sort of familiarity of my childhood body.
Yeah.
And a real sort of, I feel quite hot in quite an androgynous way, in a sort of Bowie kind of way, because I am now creating my hotness rather than it being dictated from an outside gaze by my boobs, if that
It does, yeah.
which was a very unexpected sense.
Yeah.
I wasn't expecting that at all.
It's an inside out approach, right? It's coming from how you feel about yourself rather than what someone validates you as externally in, and then by osmosis you feel hot because somebody else says you're hot.
Yeah, or somebody's looking at your boobs and you're like, I'm more interested in what you think about me as a person. Thanks very much.
Yeah.
Or what I'm doing on stage, or what I'm doing.
Yeah. I love this conversation. Because I'm fascinated about, social norms of femininity and, what that means for the world and for us as individuals.
Yeah.
So I really appreciate this conversation. I didn't have big boobs, actually, and I felt more free after my mastectomies.
Really?
Yeah, because I was quite embarrassed, actually, after my boob, because I had quite small boobs.
So almost because that had been removed.
I'd do this, anytime
So now did you feel more proud? Or you just more like, this is me?
A little bit more like that. So it's not as clear as pride, because it's muddy, right? Because but definitely a sense of there's nothing, you can't take it anymore from me, right? So this is what it is. I can't do anything about it. but less apologetic. I think that's
Yeah.
maybe what it is. So I don't know if I haven't dug around it enough to know if it's pride or,
I think there is
but
a real
it's,
apology. I think even though I loved my body as an adult, I think when we're 11, 12, when we're going through
Yeah.
puberty, there's a real shame. There's a
Yeah.
real hiding your boobs.
yes,
Or you're supposed to be proud and you go bra shopping and you get your first bra,
Yeah.
but I didn't really like that. I didn't want to wear a bra for
Yeah.
ages because I didn't want that kind of, I'm not going to say names because but girls at my secondary school who got their boobs early and the boys always made fun of.
Yeah.
And
But you were either made fun of because you had big boobs, or you made fun of because you didn't have boobs, or your boobs hadn't developed, and you couldn't win based
Yeah,
on
you can't
somebody else's perception of you,
Yeah.
and that,
so I think you're right. I think once they're gone, you're just like, oh, this is very liberating.
But this is different, right? This is not, I'm not trying to please you. And also, I think for someone, I had small boobs, so I constantly, even when I was small, the Wonder Bra, the padded bra, the T-shirt bra, like, make more. What you are is not enough by itself. We've got to make it tidier and neater and more whatever, visually pleasing. And I think that's why I feel quite strongly about the choice around, removable pieces, because, in terms of bikinis and tops, because it's totally fine, whatever you choose to do, but you choose to do it because you want to do it, not because it's dictated that is what beauty is.
Yeah.
That makes me quite cross.
Yeah, it makes me. And it is a tricky conversation to get into. I think I stopped myself earlier from saying I wasn't into performative femininity because I don't think that's fair, because I think a lot of young girls are really attracted to dressing up and putting makeup on,
Yeah.
and it's not a pressure. They are really attracted to it, and I just wasn't.
Yeah.
But I think you should, that full expression
Yeah.
of womanhood, whatever your sexuality,
whatever it is,
whatever your sexuality and whatever you're drawn to, shouldn't.
I agree. I think as long as it's coming from you, right?
Yeah.
Because your boobs can mean a big deal, a little deal, or nothing, or it can be how, they're part of our identity to lesser or greater amount. And that is okay, whatever that is for you, but it's making sure that the individual person is at the center of that, and they are okay, rather than, being dumped on, this is how you should look, this is how you should feel, this is a catalogue of breasts.
Yeah. It was very weird, actually, where early in my diagnosis, I was having a conversation with a guy I know who'd had a testicle implant, and he was talking about how it could be uncomfortable at times. And I said, yeah, that's one of the reasons I'm thinking about not getting reconstruction. And he really, like, to him, boobs were so normal.
Yeah.
That he couldn't understand, even though he'd had his own experience of I don't know, is it a prosthetic when it's internal?
I think so. I mean, I don't know.
It's not removable.
Enhancement, isn't it? It's a change. It's a visual.
So, but yeah, he had his own experience of that being uncomfortable. He somehow assumed that as a woman I would want, and I found that, I don't know if you found that a lot, there was a lot of assumption that you would just want to get reconstruction, and then that whole myth around, oh, it's a free boob job, and the lack of understanding around the fat being removed, and then to have to explain, well, my skin's different anyway because it's had lots of radiotherapy. But in a way, because it was lockdown, I told everybody via Instagram, which I don't think I would have done out of the context of being in lockdown, but because I couldn't see anybody, I was just like, I don't want to come out of however long this is going to be and have to explain to everybody individually, so I'm just going to put it down on Instagram. Yeah. So that was quite good. So nobody's ever really asked me about it since, which is great. Until now. Until now.
So what I'm hearing is that, you're a human that with a lot of different experiences, and it's almost that, what happened in your 20s and the diagnosis in your 20s absolutely has impacted everything else in your life. But potentially, do you feel like you are taken holistically, as a human, or do you think that people in the medical profession deal with those the separate elements of it as individual kind of components, as opposed to going, hang on, Tamsin and all the parts of Tamsin?
Yeah, I think very much the latter. I think because I live in London, I have London privilege, which teaching hospital privilege.
Yeah.
So I've both at UCLH and at Barts, both my cancers, I've had amazing options of treatments. And like I said, even though reconstruction was pushing on me at first. They were very open to, because that's the dominant narrative, or was the dominant narrative in 2020. I think it's getting a bit better. But they were very open to me making my own choices. Female surgical team. But I think holistically, especially as somebody that's had 2 cancers, like I'm treated now as somebody that's had breast cancer, which is problematic when it comes to HRT, and it's a conversation for another day. Not as somebody whose breast cancer was caused. Nobody ever wants to make the causal statement, but pretty obviously by radiotherapy for my first cancer. And there's not really been a follow through. So I remember when I was kind of let go from the Hodgkin's follow-up clinic, and I said, oh, it's great that you trust us to follow our own path. And the nurse in the background was like, more to do with NHS funding. And I think there is, so since I had the breast cancer, I have not really fought, but gone back to ask to get into a late effects of early cancer clinic, of which there are very few in the UK, and that's specifically as people are treated for cancers younger and survive, they see the knock-on effects, because there are other knock-on effects I might get from the cancer treatment I had, heart, lung, various other problems. But it took me 4 years to get into that, and that's 1 phone call a year. They're lovely and very responsive, but again, not a lot of people have access to that. I think in the States, where obviously medicine is commercialized, we don't really want that either, but there are late effects of cancer clinics, people follow you through, and there's somebody keeping an eye on you as a whole body.
Yeah.
And I think because of the lack of funding in the UK, and probably also cultural changes that are happening but very slowly around medicine, and even actually the oncologist that I spoke to at Barts, she said, yeah, we just can't get everybody in the room at the same time. We can't get all the different types of oncologists in the room at the same time. And I think that's what's really missing. So I've been lucky in one respect, but I think I have really had to keep tabs on things and advocate for myself. And I'm very lucky that I've had state school education, but that I have the ability to do that. I can speak English, I'm a researcher. I know how to navigate that myself. And I think a lot of people don't have that. And I think that's something that's really missing.
Yeah, because, I agree. I mean, I could go into it, but I totally advocate for the same thing. But that's how much we have to really keep on top of it as the central person that joins all the different components together, right?
Which wouldn't be bad, because we are the person responsible if that was taught in school. Yeah. And also taught to the medical profession.
Yes.
If and it is talked about more and more, but it's still not in practice.
Right.
A partnership between the medical profession and the individual. But then we also have to change the way we're taught biology and the way we're taught to look after ourselves in school, and the way that we relate to our doctors. And we also need a lot more funding and save the NHS.
Okay. If you had one thing, I mean, you've kind of answered it anyway, right? If there was
Save
one
the
thing,
NHS.
yes. But it would be, one thing that you would like to see more of in the NHS, in the kind of medical profession.
I think joined up thing and partnership.
Yeah.
But it's easy to say that, and it's easy to understand why doctors get frustrated with patients coming in having spent their time on Google. So we have to, I think it has to change from our education system, right? We have to be taught how to work together, and it's quite difficult in this age of people grabbing for one bit of information and silos of information.
Yes.
So we have to be taught to pass that information. But joined up thinking from everyone, not just the medical profession. And responsibility. Self-responsibility, and being encouraged to take that responsibility, but doctors also responding to it.
Yeah, I get it.
Which at Barts, my surgical team were very good at letting me do that after the initial.
That's what you need.
Yeah.
That's what you need.
Yeah.
Thank you.
Well, thanks for having me. I feel like we could talk about a lot more.
No, absolutely, we could.
I feel like I've ranted on.
You haven't. It's been, honestly, this has been a really, really great conversation to have, but, personally for me, as well as people that are listening, I think there's so many different facets. And as you say, we could be talking about this for the next, 4 hours.
Yeah.
Elkie,
you've got other people to speak to.
But also Elkie might go, I'm
She's
bored,
like,
mum.
I need to go for a walk.
Let's go.
Yeah.
Thank you for bringing your the intriguing interpretation of a biscuit, which I totally respect and value. And so
Well, I hope you guys enjoy them.
thank you. Thank you,
Thank
Tamsin.
you.
That's been brilliant.
Thanks. Cheers.
Cheers. Cups and Courage shares honest, personal stories of people affected by breast cancer. The views you hear are those of the guests and host and don't replace medical advice. If you're concerned about your health, please speak to a doctor or healthcare team. Cups and Courage, the podcast.